Good afternoon and welcome to the Assembly Committee on Health and Human Services. Secretary, will you please call roll?
Assembly members Dahlia. Here. Edgeworth. Here. Gonzalez. Here. Goulding. Gray. Here. Hafen. Here. Hibbets. Here. Hunt. Here. Jackson. Here. Koenig. Here. Nadeem. Nguyen. Here. Orntlicker. Here. And Chair Brown May.
Thank you. Assemblymember Goulding is also present as she's just walked in. Please mark Assemblymember Nadeem absent excused today. And we are all here. Thank you, members, for being here and on time. As a reminder for today, please silence your electronic devices as we begin this meeting. If you wish to testify, sign in at the table. Members of the public may provide testimony or comments on a bill in person or by telephone. To do so, you will dial 888-475-4499, and today's ID is 896-3462-9462, and then press the pound sign. I will repeat that again as we move into public comment later today. The agenda and committee information are available on Nellis. You may access it there. Public comment will be taken today at the end of our meeting. We do have 2 bills on our agenda. As a reminder, courtesy and respect, please, in all of our interactions in this committee. And please note that our committee members will be using their laptops, so please don't take their inattention as a sign of disrespect. I am very happy to have with us today some esteemed colleagues, present and former, to do our first bill presentation. And so with that, we will open our first bill hearing today, which requires the establishment and carrying out of a program to supplement the available food supply, Assembly Bill 474. We will call our bill sponsors forward, and we will ask you to begin whenever you're ready.
Good afternoon, Chair Brown May and Vice Chair Nguyen and members of the committee. I am Assemblymember Danielle Monroe Moreno, and I proudly represent Assembly District 1, which is in Clark County, and I have the honor of representing and serving as your chair of the Assembly Ways and Means Committee. So thank you for allowing us to present Assembly Bill 474, which creates a program to supplement the food supply for people receiving supplemental nutrition assistance program. Joining me here at the table is a distinguished guest, as the chair mentioned, former Assembly member and speaker, Jason Frierson, who is here on behalf of Cornerstone Government Affairs. He will introduce to you our subject matter experts who will be joining us virtually. And with your permission, Chair, I will now turn the presentation over to Mr. Frierson, followed by our virtual guests, and then come back to me to walk everyone through the bill.
Thank you, Madam Chair, members of the committee. For the record, my name is Jason Frierson, Frierson. I am with Cornerstone Government Affairs on behalf of R4 Technologies Incorporated. I am pleased today to help present Assembly Bill 474, a piece of legislation aimed at decreasing perishable food waste, also helping families who receive SNAP benefits get an increased bang for their buck in their purchasing power for their household. AB 474 proposes to accomplish this by creating the Surplus Food Assistance Account in the State General Fund. I wanted to just talk briefly about SNAP for those that may be less familiar with SNAP. The Supplemental Nutrition Assistance Program, SNAP, helps low-income families buy the food that they need for good health. It is expressly meant to empower low-income households to be able to purchase healthy food options. It's federally funded to help those low-income families buy nutritious food from authorized retailers. It could be families, it could be seniors, it could be single adults, but there's an income threshold to qualify for it. I want to also point out a couple of other things about SNAP in particular. For most households, SNAP is only a part of their food budget. It's not what they buy. It's not the entirety of what they use to pay for their monthly, food in particular, it's only a portion. So I think there's a misperception that people who are receiving SNAP benefits live off of exclusively SNAP benefits, and that's just not the case for most SNAP recipients. The other myth about SNAP recipients is that they are all on public assistance. And the reality is 20% of SNAP recipients are on public assistance, 80% of SNAP recipients are not on public assistance. And so this is a federally supported program designed to help them, again, primarily to help them be healthy. Now back to the bill itself. This bill basically proposes to provide an allocation for the development of technology using AI to help grocers better assess needs. There's an app that is developed and the grocers can use it. It relies on AI and algorithms to predict the needs, and it's specific to locations and zip codes and areas. And so some products may be purchased at a higher rate in some neighborhoods, and this algorithm will help grocers decide how much of a particular product, all perishable foods, that they should buy. It allows the grocers to sell more food. It helps to decrease waste so that there's fewer food going to places that aren't being purchased. But it also helps those SNAP recipients get their better bang for their buck, because when the grocers use this app, they incorporate their coupon system, and this is a system that the SNAP beneficiaries are already using. R4 Technologies has already been working with grocers to incorporate what they do into their couponing system. So this not only helps grocers sell more of their product, but it helps the SNAP recipients get a better bang for their buck when they're using those coupons that they're already using. And when I say better bang, up to 2 and 3 times the value that they're currently getting. That some, the folks to follow me will be able to go into greater detail about that. I also wanted to acknowledge that there are some folks that are concerned about the impact that something like this might have on the food bank community. I want to make it clear, the food bank community is on the tail end of where they do food rescue, and they go and get food or have food delivered that's about to expire. That's not what this is. This is helping grocers manage how they're ordering the food so that the SNAP beneficiaries can shop in their neighborhoods, at their stores, and get a better bang for their buck. I also noticed, according to the Nevada Division of Public and Behavioral Health, Nevada in particular has the highest national per person disposal rate of 8 pounds per day compared to the average in the United States of 5 pounds per day. There's clearly a challenge here, and there's clearly a need, and I understand the concerns. We have been in contact with some members of the food bank community to talk about how this has been implemented in other states, but rest assured, when we are talking about what in Nevada is over 218 pounds of food per person per year, there's still going to be some food left to be able to provide in the food banks at the end of that particular month. But this, again, allows for a more efficient way on the front end, both for grocers and for those SNAP recipients to be able to benefit as much as they can. And so with that, Madam Chair, with us we should have Paul Breitenbach, who's the CEO of R4 Technologies, and I think also important to note, was a co-founder of Priceline. Which is a different area, but they'll be able to talk about the successes they had in that area using algorithms to help folks get hotels and other things at significantly discounted rates. Also with us is former Delaware Governor Bethany Hall Long, who also championed this and was the first governor in Delaware to champion this effort. She is not only a former governor, former lieutenant governor, former state legislator. She's a professor and a nurse, and she comes with experience about how this has been implemented in other places. So with that and your permission, Madam Chair, I believe Paul Breitenbach is on via Zoom.
Thank you. Please go ahead, Mr. Breitenbach.
Yes, thank you. My name is Paul Breitenbach. For the record, it's Breitenbach. I'm the founder and CEO of R4 Technologies, and as Jason mentioned, I'm a tech entrepreneur. I was one of the original founders of Priceline. I'd like to thank Madam Chairwoman Monroe Marino and Madam Chairwoman Brown May, as well as the distinguished members of the Health and Human Services Committee. R4 Technologies, we're an artificial intelligence company started by the founders of Priceline. And why that matters is the era that we all grew up in of the internet. What made Priceline really unique and now worth over $200 billion is its ability to use math and data algorithms in real time to try to find excess capacity and match that excess capacity to demand, really helping give consumers a 70-80% discount and make producers and growers very, very profitable. And in R4, what's becoming known as the price line for food idea, as Jason was talking about, we're now deploying the AI technology in conjunction with the USDA, starting with Delaware throughout states, so that the AI can find all of the to-be wasted food. In our system, some don't know, but 35 to 40% of all the food we produce in the United States, from production and distribution to manufacture and all the way through retail, the bulk of it is 35 to 40% of that food that we produce in the U.S. is wasted all through the entire production system. So as Jason was mentioning earlier, it's an important element here now. The technology now exists to enable the government to take advantage and find that to be wasted food long before it becomes perishable and to be wasted, and match that to the demand for products, for healthy and fresh food products by the SNAP customers. And so as Jason mentioned, this is really an innovative use of technology and represents a new collaboration between the retailers, producers, and growers and the government. And the goal is to extend the SNAP benefits, 2 to 3 times the value. So if the average Nevada SNAP customer has approximately $300, the goal is to double and even maybe triple the amount of dollars worth of food they get, all by using the existing retail system, as Jason mentioned, the couponing system. So, for example, when chicken is $4 a pound, regular price, that because we know there's excess capacity in a particular store, it could be $2 a pound or even $1 a pound. Really, and the big idea is that it doesn't cost the government. No more SNAP dollars are needed, because you're literally just stretching the dollars that the SNAP users already have and enabling them to feed themselves with healthier, fresh food. As an important consideration built into the app, into the AI technology, are the SNAP Ed components. And there's a big push to help educate SNAP users of things like eat this, not that, or if you buy this, you can eat for 3 days. If you buy this, you can only eat for 1 day. These are the normal processes now that are in the SNAP program that the states execute so incredibly well. This technology just enables them not only to stretch the dollars, but help really reinforce the educational elements to it, just like we did back in the era of the internet, where we embedded the discount directly with a much better experience. And as Jason mentioned, it's important to note this is not about day-old bread or things that are just about to expire. Because the math is so good at finding and predicting what's going to be excess capacity, the idea is just to allow that capacity to keep moving through the system rather than get thrown away or wasted or discarded further on in the process. And as Jason mentioned, really the really big idea is for about $5 a year for an entire SNAP family, we have the chance of being able to double and potentially even triple the amount of food that a SNAP user can take home for the exact same dollars without costing us taxpayers any more to support the program. So with that in mind, thank you very much. And I think that we'll pass it on to Governor Holm.
Thank you. Thank you all so much. I'm very cognizant, having chaired for 15 years the Health Committee, to the Madam Chairs and members. So I recognize it's a Friday, so I don't want to repeat anything that Jason or Paul has stated. But I wanted to come today for a couple different reasons. As a nurse myself, and I know you have some physicians on your committee and others, this started as an idea actually by your own Kate Marshall. She had left being Lieutenant Governor, a colleague of mine, and was at the White House advising them on food and nutrition. And so Paul and his team creatively came up with a way that we can do more for 3 wins. To me, as a policymaker, and why I feel for Nevada it would be very important, food security is addressed already, food waste is lowered. And for those of us who worry about our landfills, I know we throw out around 30% of our food in Delaware, and I think it's very similar in Nevada. So those 3 items together, but collectively, Governor Josh Green, some of you know from Hawaii, a physician also, like some of you, myself as a nursing professor, we're looking at cancer and diabetes, and particularly our vulnerable populations, which unfortunately make up SNAP beneficiaries. who are often working 2 and 3 jobs, or seniors or elders or veterans. So to us, when we had the opportunity to combine AI innovation and to be able to have a turnkey program. I know how hard it is with budgets, and now with the SNAP cuts coming out of DC, this program is a real win. It's in our budget in Delaware. We are close to getting those coupons out with some data that can come back. But I can tell you what thrilled me is we didn't have to create new budgets, no FTEs. We didn't have to create a program. And it was not competitory with our food banks and surplus food. There was some initial concern in our state when we had these conversations, but we had stakeholder meetings. And so to those of you who have to go back to your grassroots communities as members do, I think that it's so critically important. And a piece too that is really paramount to me is the grocers were very invested, as are farmers and farmers markets. And in addition, the fact that we have the educational component is critical. I know that there are behavioral issues we have to address. It's easier to want to eat that orange Cheeto than the orange carrot. And, this is an opportunity. And so I'm not going to talk any further. I recognize your time limits, but I was thrilled to join when I was asked because I was very committed to this program as a governor, as a professor, and a nurse. And so thank you for allowing us this opportunity, and I will remain on should there be other questions. Thank you.
Thank you. Danielle Monroe Moreno for the record. I'll just quickly walk you through the bill. It's not that lengthy. So, and Section 2 of the bill requires the Division of Welfare and Supportive Services to establish and carry out a program to supplement the food supply available to recipients of SNAP. The program will utilize mechanisms to identify surplus foods and distribute it to SNAP recipients at a discount, as was discussed by our participating presenters. Section 3 creates the Surplus Food Assistance Account and authorizes the administrator of DWSS to apply for and accept gifts, grants, bequests, donations, and other sources of money to fund the account. The remaining money of the account does not revert to the state general fund. Instead, it carries forward to the next fiscal year. There is a fiscal impact where you see in Section 5 that will not be a consideration of this committee. That will be a consideration of the Ways and Means Committee, but for your awareness, it includes a $5 million appropriation to the Surplus Food Assistance Account for the purpose of carrying out the program. And with that, Madam Chair, we will stand for questions.
Thank you. Thank you for your presentation. We do have a number of questions. We're going to go ahead and start with Vice Chair Nguyen.
Thank you, Madam Chair, and just so happy that our esteemed member brought this to the committee. This just speaks to my heart. So thank you very much. And of course, welcome my predecessor back to the People's House. As you know, we live in a very diverse district in District 8, and outside of seniors, a lot of times, people don't know this, but college students are part of this population. Even healthcare provider, some of the frontliners are part of this SNAP population. So I just want to make sure that two things is addressed in my question. It's just because this is AI, so I'm sure there is an option for this two component that I want to make sure that is in there is that would the end user be able to seek culturally relevant food source with this program, as well as language access, because as a SNAP program administrator myself, in my day job, yes, most of us have day jobs here, that is one of our biggest priority is language access to ensure that the folks that use this would be able to take advantage of this as well.
Thank you, Madam Chair.
Yeah,
Through you
okay,
to my assemblyman, I was going to defer to Mr. Breitenbach.
Yes, sir. Yeah, no, thank you for those questions. The app is able to be put into.
Mr. Breitenbach, could you just state your name for the record? I'm sorry, but every time you speak, you have to state your name. It's repetitive, but it's important.
Sorry. Thank you. Learning. This is Paul Breitenbach. Do I need to spell my name?
No.
No, we have that. Thank you.
Okay, great. So just double checking. Thank you. Yeah, it could be is it, for example, in Florida and Delaware, it'll be multilingual, and so it can be configured by the state or there's instructions upon it where it could be within whatever language it needs to be in. But generally speaking, 2 or 3 languages is perfectly fine. All the recipes, for example, get translated. And your very good point about the cultural food options. That's what's really neat about this is the retailers' participation. They're highly sensitive towards the cultural needs, almost on a block group basis, and they're able to then produce coupons without any more work to them that are culturally appropriate and geographically appropriate, and also seasonally appropriate, right? So that'll happen automatically. But yes, in working in conjunction with the state, the other element you didn't ask, but if there are local producers and growers. To me, that would be another element the state would be able to incorporate to give preference if there were local producers and growers, just like you do with the farmers markets and whatnot.
Perfect.
Thank you.
No, thank you. Thank you so much for that insight. Thank you, Chair.
Thank you. Next question from Assemblymember Edgeworth.
Thank you, Chair. Thank you very much for bringing this bill. I think we all recognize how important healthy food is, especially to people who wouldn't otherwise be able to get it. I have 2 very easy questions, I think. You said that I heard you mention Delaware, Hawaii, and Florida. Can you tell me where all this has been already implemented? And the other thing is, do you have any data on how this has positively impacted? Like people have been able to get 23% more chicken or something. Do you have any data that would support this?
Paul, you can go ahead.
Okay, thank you. That's Paul Brighton. Thank you very much. Yes, so it's just now being in the process of being rolled out with Delaware. It's in the budget in Hawaii, as Governor Hall mentioned. It's in now other states such as Massachusetts, in Oklahoma. It's in process, New York State, of being put into the budget. But the preliminary now testing is right before, as we've been able to add about 33% of stretch the budget out of the coupons that are already flowing into the system. And there are retailers that are pretty far ranging that hadn't been asked yet, but both national ones such as the Walmarts and the Albertsons and Safeways have all indicated they wanted to participate. But also, even more importantly, are the Dollar Generals and the very local grocers that are in the remote areas. But right now, the preliminary belief is it should be out of the gate approximately 30% more. And in terms of if there's $300 having the effect of another 350 or almost 400. And, the goal is to really double it, right? So as the system, just like we found at Priceline in the beginning, it has to just get started. And as the retailers get used to it and the suppliers, it'll just get better and better. So thank you very much. And I think Governor Hall has a point to make as well.
Yeah, I just have one point. That's an excellent question. And one of the reasons I was able to join today was the fact that with the rollout, as Paul has indicated, we are really close to having the complete rollout. I failed to mention, I was kind of cognizant of time, that in the turnkey process, a lot of the hard work I call with the waivers has been done. It took us over 18 months to get the USDA waiver for Delaware. And that was part of why we don't have those data today. But I can tell you that the retailers, the farmers, the families are very, very interested. And just like the previous gentleman who spoke, our Director of Health and Social Services, who assisted our Deputy Secretary, grew up on food stamps. And both he and our Secretary of Ag were very important players, as I assume those 2 offices and agencies will be also when and if Nevada is able to get the program launched. So thank you.
Thank you, Chair. Can I just clarify the answer? So if I'm understanding correctly, I apologize if I missed it. Sounds like it's been implemented in 2 states and going to be implemented in 4 or 5 states. Is that about accurate?
This is Paul, right? Yeah, it's in the process of being deployed in Delaware, and next will be Hawaii. And then the other states are now, just like Nevada, putting it into their budget and in the process of rolling it out.
Thank you.
Thank you. Members, any other questions? No, I do have a couple if you indulge. Thank you so much. So I just want to make sure that we clarify. First, I heard Governor Long say that there was a USDA waiver for this program. Will Nevada need to also pursue a USDA waiver? Are you aware?
Yeah, this is Paul Breitenbeck. Yes, it's very easy. The way this was set up now is they just need to change the name from Delaware to Nevada and submit it, and it has automatic approval. Florida, for example, has already done this, as well as Hawaii. So it's what the governor was saying is the elongated process is past us now. So now it's literally just change the name on the waiver, submit it, and it will be approved.
Thank you, Mr. Breitenbach. I appreciate that. I am going to just take a moment of privilege and say, Mr. Breitenbach, we really appreciate that you're here, and Governor. It's Nevada. Okay. And every time you say it incorrectly, I can see all of my members cringe a little bit here in the room. So I also had to learn how to say it when I moved here in the 90s, Nevada. Okay. You can smile. It's okay. We're teasing you. It's
I'm
Friday.
sorry. Exactly.
I
I think
appreciate
Kate
that.
Marshall, I think Kate Marshall got me on that. I think I was saying Nevada. If I wasn't, correct me again. Thank you.
Governor, you had it. That it was correct. Thank you. We appreciate that. I do have another question, though, seriously, relative to this bill and how do we roll it out. The division that you are referring to in this measure is the Division of Welfare and Supportive Services. I'm curious to know about eligibility. As we know, there are changes federally. With many of our federal programs and potential funding. If we move in this measure, I want to make sure that what we're doing is not at risk because of changing potential federal eligibility requirements. And is the intended recipient going to still have access, right? So how is DUIS going to make sure that we have eligibility for this program? Have we even discussed that?
I'll go first and then I'll turn it over. Danielle Monroe Moreno for the record. We're living through very interesting times. From the time I wake up in the morning till the time I go to bed in the evening, we see a number of different things. Even in our Ways and Means meeting, during meetings, we're finding that funding for different things, that programs we have going on have been swept. So, have we discussed the eligibility? Those that are currently eligible to receive SNAP benefits would be eligible for this program. I wish I had a crystal ball and could say that any changes would not impact this program. I can't sit here and say that at this moment. But if a recipient is eligible currently for SNAP, they would be eligible for this program. And I hope and pray, and a lot of prayers, that those eligibility criteria do not change.
If I may, Madam Chair, again, Jason Frierson for the record. I have been in contact with the DUIS, and they are aware that we are moving forward with this effort. But as the chairwoman indicated, there's just no way to predict changes. I think that there are memos being circulated and executive orders being issued every day. The expectation is, while there may be some changes with respect to transparency and identifying fraud, that SNAP is otherwise not thus far being targeted. And so I think, have to continue to live in the world that we know. And this is again, a measure that is trying to take into account some of the pain that we're expecting to see in other areas by getting a better bang for our buck to the best that we can figure out for the time being.
Thank you. And then I do have one additional question relative to, I think, availability of food. As we've seen our grocers move about, and right, this probably would be more for our Commerce and Labor Committee, right? But with regard to availability of grocery stores in underserved communities, right? And I'm assuming, and I just want to make sure that we are clear that all types of grocers would potentially be eligible to join this platform and utilize the app. So that if you have a small grocer in a very remote or underserved community, they would still have access to this programming.
Yeah, it's Paul Breitenbeck for the record. This is the entire purpose of the program, is to find every last SNAP eligible retailer and participate. Just as a personal note, my wife's from a one-stoplight town in Ohio, and so we're very, very familiar with how important this is, and literally the individual stores in these remote communities. This is the big idea, to try to how to get more food to the people using the infrastructure that we already have. So 100% is, and that's why the the turnkey element to the technology is so important, not only for the state, so there's not a lot to do, but it's also for the retailers. And so this is why riding on the existing infrastructure is a really critical thing. Thank you.
Thank you for that clarification. Okay, seeing no other questions. Thank you for your presentation. We'll ask you to step back, and we will call forward anyone who is here in support of Assembly Bill 474. If you are here in support in Carson City, please come forward. I see no one in Las Vegas, but maybe there's one person. If you are here in support of Assembly Bill 474, you're welcome to come forward. You state and spell your name for the record. You have 2 minutes. Thank you.
Emma Doty, Emmadoty. I am a student at the University of Nevada, Reno, and in the past I have worked at the dining hall where I saw how much food gets thrown away at the end of the day, so that is something I am familiar with. More recently I have worked for the student government, and I have seen the impact of food insecurity upon the UNR student population. I have seen that there are fairs every month to help students register for SNAP benefits, which are needed, and I've seen the data on food insecurity. It is up as inflation takes its toll on the university. 33% of students are very food insecure, according to the most recent survey. I've looked through this bill, and I think it would be a great help to us at the university and to students who need this help to eat so they can take their tests, study for their classes, get their degrees. This is an essential investment in our students and in our future. Thank you.
Thank you for your comments. Thank you. Seeing no one else here in Carson City and no one in Las Vegas, AVH, is there anyone on the telephone line in support of Assembly Bill 474?
If you would like to testify in support of Assembly Bill 474, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 474, please press star 9 now.
Good afternoon, Madam Chair, members of the Assembly Committee on Health and Human Services. My name is Brian Wachter. I serve as the Senior Vice President of the Retail Association of Nevada. We want to thank the sponsor for recognizing the potential and the innovations that is inherent in AB 474. By unleashing new AI tools that are going to help government and retailers solve very complex but very real problems that are facing your constituents, is only going to be a force multiplier as we deal with some of these problems. We believe that the implementation of AB 474 is going to have several positive impacts. For one, it is going to, by supplementing the food supply for individuals facing hardship, we can improve health outcomes and the overall quality of life within our community. We think this is going to strengthen retailer engagement. Retailers are often at the forefront of community initiatives, and this program provides a structured avenue for retailers to contribute to the social responsibility efforts by donating the surplus food, and thereby fostering a culture of giving and support. And we think that reducing food waste through organized redistribution can lead to cost savings for retailers, as well as lessen the environmental impact associated with waste disposal. In conclusion, the Retail Association of Nevada fully supports AB 474 and urges the Assembly Committee to support it. We are committed to collaborating with state agencies and community organizations to ensure the successful implementation of this program, reflecting our dedication to both the economic and social vitality of Nevada. Thank you very much.
Good afternoon, Chair Brown-May and members of the committee. My name is Sheila Bray with the University of Nevada, Reno. I'd like to thank Assemblymember Monroe Moreno for bringing forth this bill that addresses food insecurity throughout our state. As previous speakers have noted, food insecurity is on the rise in our communities and our higher education campuses, maybe now more than ever. Extension at the University of Nevada, Reno is deeply engaged in food systems work with 6 identified pillars of production, processing, distribution, consumption, recovery, and access. We know that nutrition education is also an important piece of this issue. Extension is the lead SNAP Ed and FNEP implementing agency within the state that provides programming directly and in partnership with nutrition education with all SNAP eligible constituents throughout all corners of Nevada. With increased access in SNAP programs, we see food reductions in our food insecurity pipeline. We look forward to working with the sponsor on this bill, and we just thank you again for your support.
Chair, there are no other callers choosing to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition testimony. If there's anyone here in opposition of Assembly Bill 474 in Carson City, please come forward. Seeing no movement. Anyone in Las Vegas? Again, no movement. AVH, is there anyone on the telephone line in opposition of Assembly Bill 474?
If you would like to testify in opposition to Assembly Bill 474, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to AB 474, please press star 9 now. Chair, there are no callers choosing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. If there's anyone here who would like to offer testimony in neutral on Assembly Bill 474, please come forward here in Carson City or in Las Vegas. And again, no one is moving. AVH, is there anyone on the telephone line who would like to offer neutral testimony on Assembly Bill 474?
If you would like to testify in neutral for Assembly Bill 474, please press star 9 now to take your place in the queue. Again, if you would like to testify neutral for 474, please press star 9 now. Chair, there are no callers choosing to testify in neutral at this time.
Thank you, AVH. At this time, we'll call our bill sponsors back up if you would like to make closing comments.
Thank you, Madam Chair. Again, for the record, Jason Frierson. I will only reiterate that I recognize some of the concerns. I think that the concerns from the food bank community are a reflection of some concerns that we have as a country and what cuts are going to do to our communities, and they're valid. But we all share in a passion for dealing with food insecurity and minimizing waste, and I think that we will see that come to bear in Delaware and other states as they implement it, that it doesn't put in jeopardy any of our partners that are trying to address food insecurity, but it also allows for our grocers and SNAP recipients to just get a significantly greater bang for their buck. So I thank you all for your time and attention.
Thank you, Chair and Committee. Danielle Monroe Moreno for the record. Thank you for your consideration of this bill and allowing us to present it today. As you've heard, food insecurity and access to healthy food is a dire problem across Nevada. And I don't think there's more that need to be said other than I urge your support for Assembly Bill 474.
Thank you. At this time, we'll close the bill hearing for Assembly Bill 474. Next on our agenda, we will open the bill hearing for Assembly Bill 461, which revises provisions governing healthcare. We'll invite our esteemed colleague and committee member and his co-presenter to the table. Please take your time. You can begin when you are ready.
Thank you, Chair. Thank you, members of the committee. I'm David Orentlicker, Assembly District 20 on the southeast side of Las Vegas, and I'm joined by another colleague, Assembly Member Shea Backus from District 37. And on Zoom, we have Professor Nina Cohn from Syracuse University School of Law. We're going to be talking about the Uniform Healthcare Decisions Act, and the reason why Professor Cohn is joining us is she was the drafter and knows a heck of a lot about the act. So, AB 461 is the primary portion of it. Most of the sections are designed to enact the 2023 version of the Uniform Healthcare Decisions Act, which is a model act from the Uniform Law Commission. For those of you who aren't familiar with the Uniform Law Commission, it's a not-for-profit organization that brings together practicing lawyers, law professors, judges, other interested persons to develop model laws in areas that state law governs to try to bring uniformity so you don't have 50 different versions of a law. And one of the areas is for healthcare decisions. As I said, this is the 2023 version. There was the last one was in 1993, and this updates based on the lessons we've learned about planning for end-of-life care and other decisions that have to be made for patients who no longer can make their own decisions. The second part, in Section 60, would create a public awareness campaign to provide information about the importance of planning for long-term care. That's a proposal that came from the Nevada Voters Alliance. Okay, so the act itself, as I said, the main part is the Uniform Healthcare Decisions Act. It facilitates planning for healthcare decisions that might be made after one loses capacity and can no longer make their own healthcare decisions. One important way is to use an advanced healthcare directive. You might have heard the term living wills, powers of attorney. The generic term is an advanced healthcare directive, so you can decide, while you still have capacity to decide how decisions will be made in the future. You can provide specific instructions. Do you want a ventilator or not? Appoint a surrogate, a spouse, a child to decide for you. And the Act also provides guidance for patients who don't complete an advance directive. More and more people are. I think it's over half now, but a lot of people don't. And so there are default provisions for people who don't fill out one of these forms. It governs decisions to have medical treatment provided. You can say, I want treatment to keep me alive. Or you may say, I don't want treatment in some situations. But it explicitly doesn't authorize mercy killing, assisted suicide, or euthanasia. That's not what this act is about. Assembly Member Shea Backus served as vice chair of the drafting committee. I was also on the drafting committee. And this process was a multi-year process. It went very carefully vetted, broad participation. There were dozens of people involved. Representatives of the American Bar Association, representatives of organizations, not-for-profits that represent people with intellectual and physical disabilities, healthcare providers, social workers, estate planning attorneys. It really was the ULC wants to cast a broad net to make sure everybody who has a perspective that's important gets a chance to voice it. And we had many two-day meetings where we heard from all the stakeholders. Okay, with that background, we can go through the bill. Sections 4 through 27 provide definitions for key terms. Sections 28 to 31 address the capacity to make healthcare decisions or give instructions for future decisions, because a lot of these provisions kick in when the patient doesn't have capacity, and Professor Cohn will elaborate on why this is so important. But when does a patient no longer have capacity to make healthcare decisions currently or give instructions for future decisions? And one important part of those sections is to say that capacity is when people understand the nature and consequences of the decision, including the primary risks and benefits. Do they understand what's at stake? And there are also, the presumption is people do have capacity, unless found otherwise either by a court or a healthcare professional who says, I don't think this person has capacity. And if a patient is identified as not having capacity, there's a process for them to challenge and say, wait a sec, I can make my own decisions. Section 32 recognizes a person's authority to give instructions for future care. You can do it orally or in writing and by other means, videotape. And you can not only say, if I become permanently unconscious, maybe I don't want a ventilator. You can also talk about choice of doctor, choice of hospital, who should make decisions for you if you can't make them for yourself. I want my oldest child, my youngest child, my spouse. And Section 33 recognizes the formal appointments of a surrogate decision maker called an agent. You can put it in writing rather than just saying to your doctor or your family member, here's who I want you to decide. You can fill out a formal document to say, here's who I want to decide for me. So we've already adopted a model power of attorney form, or there are other ways. It doesn't have to be a written document. It can be a videotape, as long as it's signed and witnessed. And you can include not only appointing, you can combine. You can say, I want my spouse to decide, and here's some instructions. If I become permanently unconscious, I don't want a ventilator. Sections 34 and 35 recognize an authority to create an advanced health care directive specifically for mental health care. We already have a model form for that. We have the generic model form and the mental health care, because mental health care can be, people have different feelings and more nuances there. And it allows for so-called Ulysses clauses. If you remember the Odyssey and Ulysses wanting to listen to the sirens but not wanting to be lured to his death, told his shipmates, don't listen to me when I tell you to stop. Keep rowing. So this allows people with mental health concerns to say, here's how I want you to treat me if I have a specified psychiatric or psychological event. Listen to me now when I'm not in that situation, not what I say then. And that's optional. Sections 36 to 38 recognize default surrogates. If you don't appoint somebody, you don't have this formal appointment, you haven't written a document, then we know who to turn to. It could be someone you've identified. Recall earlier that you could say orally to your doctor, I want my spouse to decide for me. So that's the person has priority. And then your spouse, other family members, a cohabitant, someone who's previously assisted you in making decisions. You've gone to the doctor, you brought a friend or family member who helps you make with your doctor's appointments and making decisions, or a person who's exhibited special care and concern. So again, the idea is to cast a broad net. If there's somebody out there who knows you and cares about you, they should be the one to make your decisions. You can disqualify potential surrogates. You might say, I don't want my sibling or my child. You can choose among a lot of people, but please don't choose A or B. And you can do that orally or in writing. Section 39 is about revocation. You can revoke your advance directive. And there's also a provision for automatic revocation upon divorce, which can be waived. You don't have to do that, but it's in there as a default provision. Section 40, what if you have an advance directive that you created in Michigan and you've moved to Nevada? It's valid. If it's either valid under Nevada law or your other state's law. So they're portable, these advance directives, somebody coming in, and of course, anything you executed before the adoption of this law. Section 41, if you're going to serve as a surrogate, you have duties to the patient, and Section 41 outlines those. And the primary one is the surrogate is supposed to decide based on patient's instructions, goals, and preferences, which they can set out in the model form. And if you don't have that kind of information, they didn't leave instructions, then you turn to the patient's best interests. Section 42 says, when does the surrogate have authority? When the patient lacks capacity. If the patient can make decisions, you turn to the patient. But when they lose capacity, you turn to the surrogate. Section 43, if you have a person with long-term disability who's required nutrition and hydration and has wanted nutrition and hydration, then we presume they want it continued unless they tell us otherwise. Section 44, you can appoint co-surrogates. You may want to say, all of my children should be deciding for me. Section 45, describes duties of the healthcare professionals. You have to respect the patient's instructions or those of their surrogates, and also to make efforts to identify whether there is a surrogate. There are exceptions for if you have conscience objections to following the patient's instructions. There's an exception for that. There's also if care is not consistent with generally accepted healthcare standards. This doesn't allow patients to demand inappropriate care. It allows them to accept or refuse appropriate care. Section 47 provides good faith immunity for healthcare professionals and institutions from civil or criminal liability or discipline for unprofessional conduct for reasonable decisions to comply or not comply with surrogate decisions or patient instructions. So if it looks like it's a falsified document and you don't participate, then you don't get into trouble. And if it looks like a legitimate document and you do comply, then you'll be okay. Section 51 provides, this does not authorize mercy killing, assisted suicide, or euthanasia, and withdrawal of care, whether you're turning off a ventilator, dialysis, feeding tube, doesn't constitute a suicide or homicide, including for benefits of insurance or annuity death benefits. Lots of conforming changes. And then Section 60 requires creation of a public awareness campaign about the importance of planning for long-term care by DHHS through its Aging and Disability Services Division. I've discussed that with them, and they're comfortable with this. Section 71 provides a model for an advanced directive for mental health care, which actually is already in statute. They're just conforming changes. And again, the primary model advanced directive we adopted 2 years ago. That was AB 414 that our colleague, Assemblymember Backus, sponsored 2 years ago. That's already in statute at 162A.855. The reason why we only did that was the full act hadn't been finalized till after we adjourned. And that's my presentation. I'll just say we have a conceptual amendment. So one of the things that's been a problem with our statute is we have lots of forms. And one of the goals of the Uniform Healthcare Decisions Act was to take all the lessons we've learned and come up with a single, very accessible form that covers everybody. And given that we've adopted that, the conceptual amendment will delete 2 forms that were adopted many years ago and that are in a different part of the code in Chapter 449A that really are superseded by the Healthcare Decisions Act. We also deleted some special forms for people with intellectual disabilities or early signs of dementia because, again, the Uniform Act that we model form that we adopted 2 years ago was designed to cover the situations of people with disabilities or early Alzheimer's. We had input from their communities when we were drafting, and we felt it was better to come down to the single form that really should work for everybody, rather than having this confusing menu of forms and that patients may end up with the wrong form for them. So that's what I have, and I'd like to turn to Professor Cohn if we have time before questions.
Hi, thank you. My name is Nina Cohn, and I am currently sitting in upstate New York. It is a pleasure to be here with you today. I'll just make a couple comments about the overarching structure and goals of the Uniform Act. This is an act that is designed to make healthcare decision-making easier for patients, for healthcare providers, and for families. And there's many ways it does that, but I just want to highlight a couple things that I think are particularly important. Key point of confusion we see in many states and Nevada as well is that although laws state that a patient makes decisions when they have capacity. Laws don't spell out what that means. And the result is it's really confusing for patients, for their families, and providers, because we're asking healthcare providers to say, does this person have capacity? And you and I both know that whether you have capacity is sort of a loaded question. Capacity to do what? What do you mean? To choose what I eat tonight or to decide on a major heart operation? And so the Act really clearly lays out a presumption of capacity and then precisely what you need to understand in order to make a healthcare decision or make an advance directive. And it also explains what happens if the patient says, no, I can make this decision for myself, which is actually a pretty common thing to have happen. And right now, the law doesn't say what happens in that situation. And so patients, family members, and healthcare providers are put in a really untenable position without guidance on that. So that's just one of the ways that the Act is trying to clear up confusion, to streamline these decisions, and to hopefully reduce the stresses on patients, on providers, and on family during these difficult and often emotional healthcare decisions. I'll stop there, but thank you so much for considering this act.
Good morning. Shay Backus, Representative Assembly District 37. I'm not going to go into this, but I just want to stress, like the three of us, along with a lot of the other people and a numerous amount of observers, participated in a 2+ year process. I say that because only Nina was a part of, Professor Cohen was the only one at part of the study committee before this, and observers were involved. So like us wanting to remove a form regarding one for the use of in the disability community, we had representatives that were observers, including members from the ARC and other disability communities around the country. There were gobs of people, and through your questions we can use examples if there's something you're concerned about of voices that were at the table when we generated this uniform act. So thank you.
Thank you. Thank you for your presentation. Thank you. We have a couple of members with questions. We'll start with Assemblymember Edgeworth.
Thank you, Chair. Thank you, Assembly members, for bringing this whole bill up. This is an extremely, as somebody who's had many, many conversations with families and with people, and this is a very hard conversation. It is very confusing when it should be so easy. You would think it would be easy, but it's not for anybody involved. My question is, you, in sections 30 and 31, you say you're addressing capacity. You're exactly right. The word capacity actually makes me panic a little as a physician. So I know exactly, and competence and capacity are very confusing. So my question is, it says in the sections, healthcare professional or responsible healthcare professional. You don't have to read it. I'm just asking which healthcare professional would be, is it delineated who's allowed to decide capacity? The court system, I think that one is pretty straightforward. But who is a healthcare professional? I would assume I'm a doctor. I would assume I am. But is that probably in the NRS and I didn't know? I'm sorry.
Yeah, David Orentlicker. So a lot of this comes back to the definition. So Section 23 talks about who the responsible healthcare professional is. Somebody designated by an individual or surrogate to have primary responsibility. And then health professional itself would be Section 14, a physician or other individual licensed to provide health care in the state. So it could be a physician, but it could be another person who's professional who's licensed.
Just a point of clarification, not another question. So people who are allowed to provide medical care in the state of Nevada would be PAs, MDs, DOs, APNs? Is that what it's limited to, is people who are medical care providers? I'm sorry, I'm more of a doctor than a lawyer. Or could it be ancillary people like a psychologist, or that's my only question. Thank you.
Thank you so much, Assembly Member, for your question. Shay Backus, Representative Assembly District 37. I'm going to kick this up to Professor Cohn, but Section 14 does define the healthcare professional, which means a physician, and I think your inquiry is, or other individual licensed, certified, or otherwise authorized or permitted by law of this state to provide healthcare in this state. So I would agree with what you're saying, but I want to shoot it up to Professor Cohn as well to make sure that I am making that representation correct, because we spend a lot of time on these type of things. So I'll include her too.
Yes, it's a broad definition. Nina Cohn, sitting in New York.
Thank you.
Thank you. Next question from Vice Chair Nguyen.
Thank you, Madam Chair, and thank you, Dr. O and Assemblymember Barakas, for bringing this forward. It's a really, really short bill, just 52 pages. But in reading this, and you're probably going to know about my line of question because I actually do this all the time. I combed through the language, and there's only one section, Section 60, page 33, that addressed specifically the proficiency or lack of proficiency in the English language. And I'm concerned on that a little bit because there's only one very small section of the bill that addressed this part. And I want to see if you have plans to put in place culturally language or language access capacity for this uniform code, because I think that's important in terms of folks who are not be able to communicate this thing in a different language, and also directive that may be coming from other countries that maybe they're immigrating here and end of life is here in the United States, and how do we make sure that we kind of tie this in together in terms of ensuring that the folks who have language and culturally relevant end-of-life directive that is included in this uniform code. Thank you.
Thank you so much, Assembly Member Nguyen, through Chair Brown May.
Please go direct.
Thank you. Shay Backus, I was trying to be very expeditious. Shay Backus, for the record, representing Assembly District 37. I just wanted to explain a couple things because I kind of brought the first part of this bill last session, which was AB 414, which included a proposed form. In that form, we spent a lot of time in plain language. Unfortunately, Section 60 that you're referring to is a kind of a little part B to this bill to make it a better bill is how I see it. But the first portion pertain to the uniform law, and I get what you're saying, and unfortunately, while we had very diverse members in our group, one of the things is when we did our form, we used a plain language expert, but to be able to do that as part of the Uniform Law Commission, that utilized a lot of resources, and we were going to have one of our general counsels here today too, but we'll take notes because I think that's really important. It's something when I'm doing uniform law, we usually don't do forms in any of our bills. This was a special one, and it was because we wanted to make it user-friendly, except there wasn't any, we didn't put it in any other language because it was going to go into statutory law.
Just a quick follow-up, Chair. So I think just looking at all of this, wanting to make sure that we address that piece, maybe not particularly in the forms itself, but maybe in the process, that there is a connection to those who are in the culturally relevant communities that have different processes, that we want to bring them in the same page with this.
Shay Backus, for the record, thank you, Assembly Member. We did have people, like now that I'm looking back, like observers who participated, who were kind of like on the front lines in hospitals and representing variety of different communities that were at the table as observers. I was thinking you were thinking more of a language issue with respect to the form that is already in Nevada law, but we did have like different people from all different backgrounds participating and discussing this to make it the best law that we can make it.
Any other questions, members? Go ahead, Assemblymember Hafen.
Thank you, Chair. And I want to dovetail off my colleague from Assembly District 35's comment on Section 14 and kind of just point out that there is a little bit more description in Section 29 that talks about I'm more curious how Section 14 and Section 29 would interact. Section 14 is a little bit more vague in who can do this, but then when under Section 29 it gets a little bit more specific when you get into the lack of capacity. So I just thought maybe you could kind of explain a little bit of how those two sections would interact and why there's a little bit of difference there.
Thank you, Assembly Member Hafen, for the question. Shay Backus for the record. I'll rephrase your question, and I would be happy to have Professor Cohn jump in. With respect to Section 29, your question is, because you're looking, it seems to me, that you're looking at Section 29, Subpart 2, and then you have the examinations, and it lists like an order where subpart 4 under 2A has a responsible healthcare professional. And in response to your colleague from District 35, asking for healthcare professional, she was inquiring about who that was. In Section 14 merely defines healthcare professional, but I'll turn it up to Professor Cohn to kind of elaborate, maybe to answer some of your more concerns.
Nina Cohn, sitting in New York. In Section 29, we wanted to spell out a number of types of professionals here that might be a bit broader than the term healthcare professional, recognizing that the folks who have training in capacity assessment may include, for example, the clinical social worker, and wanting to recognize the relevant training and expertise that may fall outside your more traditional healthcare providers. There was a particular, I will say, as we were working through these issues, we heard from people in all different types of healthcare systems, and especially those individuals with experience with very rural healthcare systems wanted to make sure that these categories were inclusive enough that where staffing is limited, there would be people who would be qualified to make these important determinations in a timely manner. I hope that helps.
It does. Thank you. Thank you, Chair.
Thank you. Members, any other questions? No other questions. I just do have one comment. I want to just thank you for your efforts on behalf of folks who have intellectual and developmental disabilities. I know that there's been a lot of work that's been done around this and relative to supportive decision making and how do we build teams. So I thank you for your considerations there. Seeing no other questions, we will ask you to go ahead and step back at this time. And we will invite anyone who would like to offer testimony in support of Assembly Bill 461 to come forward at this time here in Carson City or in Las Vegas. See no movement. AVH, is there anyone on the telephone line in support of Assembly Bill 461?
If you would like to testify in support of Assembly Bill 461, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 461, please press star 9 now.
Good afternoon, Chair Brad May, committee members. For the record, my name is Matilda Miller. That's Mathilda-Miller, Government Relations Director at Native Voters Alliance in Nevada, in unwavering support of Assembly Bill 461. When I was 18, I had to make life or death medical decisions for my dad while he was on the ventilator in ICU for 2 months. I remember sitting outside the Panda Express at UNLV Student Union, exhausted in tears, jumping between 30 to 40 different web pages, trying to understand the forms, what procedures the doctors were asking me to approve. I remember I kept asking myself, is this something that my dad would want? Am I doing the right thing? And can I carry this burden? And I told myself that once my dad gets home, I never want to go through this pain again. Thankfully, my dad survived, but I'm still carrying the trauma of the decisions I had to make without guidance. That moment didn't just change me, it forced me into adulthood before I was ready. Now, 8 years later, my father is facing the hardest battle of his life. We're trying to be as prepared as we can, but the truth is, I still feel as lost as I did at 18. And I used to think that this was just something that happened to me, but it's not. I've spoken to my friends, coworkers, and volunteers who have all shared similar experiences where they're confused, overwhelmed, and unsure on how to navigate medical decisions for someone that they love. They didn't know what an advance directive was, they didn't know how it worked or how to create one, and when they did, they were really confused. If you've ever had to care for a loved one and you carry the weight of making decisions for them, then you know how deeply personal this is. If you've ever had to wish for clarity, support, or peace of mind during a medical crisis, then this bill is for you too. We urge your support for AB 461. Thank you.
Good morning, Chair and committee members. For the record, my name is Jajona Witherspoon. That's JIZHONI-WITHERSPOON, and I am a member of the Navajo Nation. I am testifying today in support of Assembly Bill 461 because my parents and grandmother aren't getting any younger. The day when I have to take care of my parents is coming very soon. And this bill would ensure that I am prepared and I am protected when that day comes. Thank you.
Hello, Chair, members of the committee. My name is Tony Ramirez, TonyRamirez, and I want to ditto all previous supporting testimony. Thank you.
Follow with the last three digits, 748. You are unmuted and may begin.
Yes, hello. My name is Minerva Martinez, M-I-N-E-R-V-A. Martinez, M-A-R-T-I-N-E-Z, and I am supporting AB 461. As a parent, I am worried what happens to my family if I get very sick and am unable to, I cannot speak for myself. I don't want my children to be confused or afraid. I want them to know what I want, and I want them to be protected. This will give my family peace and help us to make these hard decisions with love and not fear.
Follow with the last three digits, 939. Please press *6 to unmute your phone. Caller with the last three digits, 939. Please press *6 to unmute your phone. You may begin.
Good afternoon. This is Tammy Romo, T-A-M-I-R-O-M-O. I want to thank the person who presented the bill. He did very well in going through all the different categories, because it's quite a big bill to completely read and go through everything, especially if you're not completely familiar with all the medical terms. However, I think you guys wrote this bill very well. It seems like all bases are covered, especially the importance of education before anything happens, and then after something should happen, that, you know, these are your options and your choices. The only thing that I'm a little bit concerned of is because of the recent COVID pandemic, that some of the nurses or healthcare professionals, which we still haven't quite decided who would be in that category from the discussion we just had, that sometimes they get stuck between insurance needs and the needs of the patient. So I would hope, and we saw that a lot during the COVID, so I would hope that that the healthcare partner that is truly chosen, if the person should have no family or a person appointed, that person, that healthcare professional, would make the right decision for the best interest of the patient and not anything else, you know, as far as insurance, because we know insurance does make a lot of the medical decisions, you know, nowadays. So I fully support this bill, and we can just get some of those kinks out. I think it would be a great bill, and definitely get that education out there and going. And I'm still a little choked up from one of the first gal who spoke. So thank you very much, and thank you.
Good afternoon, Chair and members of the committee. My name is Jessica Padron, for the record, and I serve as the Advocacy Director for AARP Nevada. On behalf of our membership that is comprised of seniors and caregivers of all ages, we enthusiastically support and endorse Assembly Bill 461 and urge its passage. Thank you to both of the Assembly members who presented the bill today. AB 461 represents a crucial step in modernizing Nevada's approach to healthcare decision-making by fully adopting the Uniform Healthcare Decisions Act. This legislation will have meaningful and lasting impact for older Nevadans and their families. We are excited to see that it provides clarity on decision-making authority and educates the public on long-term care planning. By passing AB 461, Nevada will be able to join several other states that have embraced these provisions, fostering consistency in healthcare decision-making and ensuring that advanced directives are recognized across jurisdictions. AARP Nevada firmly believes that AB 461 is vital in protecting the autonomy and well-being of our state's aging population, and we respectfully urge the committee to advance this bill. Thank you very much for your time and consideration.
Well, with the last three digits, 332, you are unmuted and may begin.
Chair and committee members, for the record, my name is Jason Tan, Jason, excuse me. Last name is Tan, just like suntan. And I'm testifying in support of AB 461. In a day when insurance companies and hospital costs dictate how a person navigates their medical and health conditions, and with American rights being less guaranteed than ever, it's imperative that the citizens of the country, and in this case, today's case, Nevada, are affirmed with their personal right to autonomous decision-making power. I believe this bill will clarify many legal gray areas and protect individual rights for what are often the most vulnerable and scariest moments of a person's life. At some point, everybody hearing my voice is going to face the end of their lives. It's a lonely closure that a person experiences by themselves, even if they're surrounded by friends and family. And whether it's long-term healthcare decisions or allowing a trusted family member to carry out a loved one's desired medical care, the ability for the individual and family to keep that control is paramount to the dignity of that person's life. We're all going to get to that point, so it's in everybody's best interest to clearly modernize and find the protections of the last thing that we have in life, health. I strongly urge this committee to support and advance AB 461 to protect the health and dignity of all Nevadans. Thank you.
Hello, committee. Chair and members of the committee, Benjamin Challoner, BenjaminChallinor, Nevada Director of Public Policy for the Alzheimer's Association, here in support of Assembly Bill 461. When a person in late stage of Alzheimer's or dementia, a degenerative brain disease, nears the end of life and is no longer able to make his or her their own decisions, families must make choices on the person's behalf. Ideally, the person with dementia has put in place advance directives that specify his or her wishes. Without such directives, or if certain issues have not been addressed, families must make choices based on what they believe the person would want. All end-of-life decisions should be respect the person's value and wishes while maintaining his or her comfort and dignity. When advance directives are not in place or do not address every issue of end-of-life care, it can be difficult for families to make these decisions. We always encourage people living with dementia and their caregivers to have these conversations with their providers and their families before the disease progresses. We at the Alzheimer's Association believe that all families and caregivers should be prepared. The uniformity of AB 461 will help this. The public awareness campaign will help this. Additionally, I also serve as the chair of the state's task force on Alzheimer's. While I do not speak on behalf of the TFAD today, I do want to bring to the committee's attention the biennial state plan to address Alzheimer's disease and other dementias submitted to the legislature earlier this year. In particular, recommendation number 9, advanced care planning. This bill addresses some of the pieces within that recommendation. We urge your support and we look forward to implementation of this bill upon passage. Thank you.
Chair, there are no other callers to testify in support of this bill.
Thank you, AVH. At this time, we'll move into opposition testimony. Is there anyone here who would like to offer testimony in opposition of Assembly Bill 461? Seeing no movement here in Carson City and no movement in Las Vegas. AVH, is there anyone on the telephone line in opposition of Assembly Bill 461?
Chair, the public line is open and working. There are no additional callers to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. Is there anyone here who would like to offer testimony in a neutral on Assembly Bill 461? No movement here in Carson City, no movement in Las Vegas. AVH, let's check again. Anyone on the telephone line who would like to offer testimony in neutral on this measure?
Public line is open and working. There are no additional callers at this time.
Thank you, AVH. At this time, we'll call our bill sponsor up if you would like to make closing comments.
Thank you very much for your, David Orient-Licker, Assembly District 20. Thank you very much for your helpful questions. We'll be happy to work with you for clarifications, and so please let us know what, and I've taken notes, but anything, please follow up and we'll work on that for the conceptual amendment.
Shay Backus for the record. I just want to say thank you, and we are available and happy to talk about the bill more and dive into some of those provisions as I was doing Section 29 while we were doing that, so happy to discuss those further with you as well. Thank you, guys.
Thank you. At this time, we will close our bill hearing for Assembly Bill 461. That moves us into the last order of business for today on our agenda, which is public comment. Members of the public may provide comment by telephone. To do so, you can call 888-475-4499. Today's meeting ID is 896-3462-9462. If anyone is here in person to provide public comment, you're welcome to come forward at this time. No one is moving in Carson City. I see no one in Las Vegas. AVH, is there anyone on the telephone line who would like to offer public comment at this time?
Callers, if you would like to provide public comment, please press star 9 now to take your place in the queue. Again, if you would like to provide public comment, please press star 9 now. Chair, there are no callers choosing to provide public comment at this time.
Thank you, AVH. Members, that concludes our business for today. We are scheduled to meet on Monday. I hope you all have a wonderful weekend. With that, this meeting is adjourned.